Welcome, I'm Barbara Marcum, and this is Friendship Focus. With me today we have Dr. Brackney, who is a local chiropractor, and welcome to the show. Thank you for taking time out of your day to be here.
Hey, you're welcome. I'm always glad to educate. That's one of our focuses, education in our office.
That is our focus as well, and that's why you're here today. Actually, years ago, in the 70s and 60s, chiropractic care was really poo-pooed, okay? And I actually had, in the 90s, I thought, I'm not going to a chiropractor. My back was really bothering me. And I ended up going to a chiropractor through my roommate, Debbie, at the time. I thought I must have bone cancer or something. My back is really bothering me. And within a month, I was completely pain-free, which changed my mind. Okay, so then I'm reading in the New England Journal of Medicine, they put chiropractic care as now being the #1 treatment for back pain. And we see a lot of lower back pain and things where people, through their jobs and everything. So I really want to talk about chiropractic care, how important it's become, how integrated it's become with other medicine. So thank you for being here today. And let's get a little background about you. Why did you decide to become a chiropractor?
Well, there's a couple different turning points I had in my life, when I wanted to decide what to do with my life, which is a hard question, I think, for everyone. What are you going to do? Mm-hmm. And, one of the things I remember growing up, I used to go to my grandma's house. I had two grandmas. I had my nice grandma and I had my other grandma. And I was at my other grandma's house, and we were sitting there. My mom would come over every Sunday, and she had these rows of pills, and she would just box them up every day, because my grandma couldn't sort them or figure them or keep track of them all. And so I'm sitting at the table there, because that's just kind of what you're doing, waiting to go. And one of them starts rolling across the table. And I remember it was kind of red, it was kind of shiny, and it just, so I picked it up and go, looks fine. And I'm going like this to pop it, right? And then my mom's like jumping up going, no! And she blasts me. I'm like, what just happened here, Mom? What? I just, okay. She's like, you can't take that. I said, okay, why? She goes, it'll make you sick. I go, you're giving it to Grandma.
It's going to make her sick?
It's going to make her sick. She needs it, but it makes you sick. Can you take it? No. And I thought, Grandma's really not that well. Like, but there was no explanation. Grandma needs it. Okay, so we went with Grandma needs it, and I said, it sat there, Now, I come from, I'm a Michigander. I lived in Downriver, and we come from a Ford family. Think of what you like. My dad retired from Ford's pipe fitter. My brother works there. My uncle worked there. My grandpa worked there. I probably could have worked there. But I remember, and I was probably maybe a freshman. My dad was having some back issues, and he had been taking all this medication. He was kind of on the couch, and I said, how's your back? It feels good. I go, great. Okay, you're all done. He's like, no, I got to keep taking this stuff. I'm like, what happens? Well, it's going to wear off in a couple hours. And I thought, well, if you feel fine now, why do you need to keep taking this medication? Why isn't it actually done, And I said, that just never sat well. Like, the solution didn't work. So, as I kind of went on through my life, I had to decide what to become. I love the human body. I really thought the eye is fascinating. If you ever think about turning light into an image in your brain and all the technology that happens in the body, that was cool. So I went to my optometrist and I said, hey, because I always needed glasses. I said, hey, how do you like being, an eye doctor? He goes, well, it's about 8 years of education. I said, okay. And you sit in the dark room and you look at eyes all day. And I said, thank you very much. What else can I do?
That's all I need to know.
Right? Right?
Yeah.
But I'm thankful for those, but I'm too much energy for that. So I was like, okay, I found this thing called chiropractic, and I didn't know what it was. And I started researching it and said it doesn't have blood, and it doesn't have needles, and it doesn't have, drugs. And I go, oh, but people get better. So I'm like, well, how could that be? I've never seen that, I was raised very traditional medicine, go to my family doctor or, pediatrician, and there's something wrong, and that's just how I was raised. So I go and I said, hey, to this chiropractor, Dr. Kuzno, was a great chiropractor, and I said, I'm thinking about being a chiropractor. Can you show me a little bit about it, and how did you like your university? Mm-hmm. So he says, well, follow me. And I said, well, what? And so I'm watching him go room to room, and he's working on people, and they're getting up, they're smiling, they're happy, they're telling me they're feeling better, and I'm going, wait a minute, you just do this all day long? He's like, yeah. I'm like, I'm in. So after that, I continue just to pursue that as a career, and it's been wonderful.
Well, I will tell you, I especially tell seniors, as you get older, sometimes surgery is just not the best answer. And because they grew up in the 60s, okay, and 50s, when chiropractic care began, okay, like when people knew about it, they still are of that same mentality. And unless you have a good experience with that, sometimes I think they think, no, the chiropractors are quacks. Oh, not so. So I tell them, always try something like that before you have cuts and spine surgery and knees and all of that stuff. And there's some really cool stuff that they're doing now. And you and I were talking before the show about the knees, and we'll get to that. But according to the American Chiropractic Association, there are like 70,000 chiropractors now in the United States, okay? And I think what's interesting, it's like about 70 million people have some type of chronic pain. Back pain and lower back pain is like the number one.
Sure.
So what are the different conditions that you treat as a chiropractor, and like what does it help? The bones, cartilage, connective tissue, joints, and all of those things. So let's talk a little bit about that.
I will, but Barbara, if you let me back up a little bit.
Sure.
You were just talking about, chiropractic started in 1895. And actually, a deaf man got his hearing back after they worked on his spine and opened up some nerves. Harvey Littler, D.D. Palmer was the gentleman who was trying to figure out how to get people better. So chiropractic they actually thought they'd agree for deafness. They were trying to, all you deaf people kind of come in here. But then they actually found the Merrick chart, which means you could trace nerves in your body. Like if I know I've got a pinched nerve here, I could trace the nerves all the way up to my neck. But your organs also have nerve supplies. Your heart has nerve supply, your stomach, all your intestines, and they can also be traced back through the spine. So chiropractic's been used for a long time. It was actually it was used to get the whole body well, not just for a back pain. But what actually happened, a couple interesting things happened. But let me just fast forward ahead to 1978. In 1978, the American Chiropractic Association won an antitrust lawsuit. Do you know what an antitrust lawsuit is?
Yeah.
Like when one profession or one thing tries to wipe out another industry. So the American Medical Association was trying to wipe out chiropractic completely.
Yeah.
Like it's a competition. So they actually had put out things, chiropractors are quacks. That's where that kind of came from.
Yeah.
They had said, if you associate with a chiropractor, refer to a chiropractor, we will take away your license. This is all well documented. So they were actively trying to wipe out this profession because, quite frankly, chiropractic profession is drug-free, and we think kind of opposite of the medical model, And I tell people, I said, listen, I'll be on your team, but I'm not going to be your team. So when you come to see me, you still have other things you need to do. But because of this, and it was so hard that it was taught in the colleges, it was taught everywhere. So it's taken us generations to undo, because imagine if you're part of the American Medical Association, you were told these guys are terrible, and you don't have you don't have any experience in it. You don't know if it's true or not. You listen to your experts in your field, and you say, "Well, don't do that." And I said, "Okay, I won't do that. You'll get repercussions." Well, then I'm definitely not going to do that. So that's where kind of the generation, the seniors, kind of grew up in that generation where they were really told, "Don't go to a chiropractor," for incorrect reasons.
So you're absolutely right.
And it's taken a long time. And now, as you said, I take care of tons of nurses. I take care of, all the time, I take care of medical doctors and all kind of other health professionals. So times have changed, and people realize it just keeps working. It doesn't, and what happened was, in the 1980s specifically, insurance started to cover chiropractic because people demanded it. They're trying to figure out what to do with it. So they said, well, we know it works for backs, so we'll start covering it for back and spine things. So it kind of limited us down to, from a whole body helping everything, to insurance pays for backs and necks. And so most of the research initially was all done on that, just proving that it works.
Yeah, right.
So that's why we kind of have that mentality of, what about chiropractic and what do we use it for? And
That's very interesting because you talk about what professions are the most respected, so, and doctors being way up there. So when doctors were telling people that, they just bought it, hook, line, and sinker. So you're right. That is exactly where they're coming from. So when you mention that, they look at you like chiropractor, and it's like, always do that first. I met the guy that I went to because he fell out of a tree blind, and he was a chiropractor himself, and they came in and said, oh, you need surgery on your spine. He said, if I didn't know what I knew as a chiropractor, my friends came in and adjusted me 4 times a day in the hospital. You can't even see the break. And so he's the one I went to, and that's when I changed all of my thoughts about chiropractic care. And you're right, it's not just the back. It is the whole thing with the central nervous system, with everything works together. And so I really now tell people, yeah, don't make any changes as far as severe surgeries. See a chiropractor first and see what happens.
Yeah, Barbara, you're absolutely right. And I've said that before. You can always do surgery,
right?
But
as
you
a
can
last
never
resort.
go back.
That's right.
And I guess I see people that come to me after the surgeries didn't work.
And that's a problem.
And so I know that they don't always work. Mm-hmm. And you sign waivers that they might not work, but people will go just assume all this money and all this research and technology,
going to work.
It's going to work,
mm-hmm.
Right?
You're right.
But you can, like I said, you can always do surgery, and if it doesn't work, then you can always do that. But it's got to be, like you said, the last thing. I was just talking to a patient earlier today that was having a lot of knee pain, and they said, well, we should do surgery. And they're like, well, yeah, but I didn't have time to be off work for all the weeks. And so, we started doing exercises and stretching and strengthening. And he's like, sure enough, like 3 months later, he didn't have any knee pain. And he's like, I'm totally doing whatever I want to.
So thankful I didn't go under the knife.
Exactly. And it wasn't because he didn't think it wouldn't work, but he just said, I don't have time for the rehab. I don't have time for all that stuff. He did natural things. There's a lot of things you can do and take. And in our office, we have laser therapy and a lot of different things that you can do to help the body regenerate in there. But the surgery is always risky. You always want to do it last resort, and doesn't mean never. It just means fewer, less surgeries.
Try something, anything else before,
Absolutely.
Right?
And I've had people, I said, listen, you're beyond what your body can naturally overcome. And that's the reality is, sometimes you wait too long to do something, but let your body give it a chance. Give your body a chance before you do that.
So what are the most common conditions that you see in your office?
Well, I would say probably migraines, if you just kind of think a lot of headaches and migraines. A lot of people suffer. That's a lot of tension in their back. What we're really seeing that from is phones. We're really seeing a lot more, we call it texting neck or technology neck. Today, we in our office, we take x-rays, so we know exactly what's going on.
Well, you have to do that before you treat somebody.
Absolutely,
make sure there's nothing
else.
Well,
not all chiropractors, there's a philosophy, not all chiropractors do that. But
okay.
And I've actually seen in the last 2 years, more 30-year-olds in their mid-30s, today was 34, with arthritis in their neck, like I'm talking about bone spurs. I never saw arthritis in the neck. I've been doing this since 1996, and I've never seen arthritis until the last couple years in the neck. But now, you know what we are? We're over 10 years of iPhones, iPads, all these things where people are just constantly looking down for work, play, and now if they're literally being raised looking down, and we're seeing something that we shouldn't see, period, but we usually would see in your 50s and 60s happen in their 30s. And if you think of how bad it is with all these kids, I was shocked. I was looking, I was at a park, and they have strollers with these little mounts, like an iPad. I'm like, you're outside. Why'd you have your kid, looking down in the stroller at this when there's a whole world to look at? And I would love to actually do a whole show on how devastating technology is in the development of the human brain, because it changes all kind of neurological patterns, all kind of brain stimulation. It takes away creativity, does so many things, but we're now seeing it because now we've been long enough to go, oh, this is not, and people have been banging the drum, and I know I'm off on a tangent here, but it's terrible because it's the quickest babysitter you can have. Your kids are crying, take this, oh, they're quiet, and you don't have to deal with them for a while.
Well, I'm smiling because we did an interview with Dr. Ackler, and she was talking about the nearsightedness that, kids are looking at things. So it's not just chiropractors who are seeing it. A lot of different areas are seeing the problems that are coming across now physically with the public of all ages because of phones, tablets, computers.
Yeah, and that's why one of the things I said, headache and neck pain, and I'm seeing it in children and teenagers. It's not, not just a midlife thing or an old age thing. It's happened in all things. We're also seeing more numbness in the hands, and again, some of that neck pain stuff. Obviously, you mentioned back pain is a really big one. We see a lot of sciatica, which kind of accompanies back pain. But remember, jobs now, how often are people sitting? I mean, they're working from home. You don't have to shop anymore. You don't have to walk around a grocery store. You don't have to leave your house for anything. So now we have more people that are sitting longer and longer, and that's just terrible on the spine.
Our bodies weren't meant to, they were meant to move.
You're absolutely right.
You know what I mean? So that movement keeps everything going. And then when you are sedentary like that for a lot of different reasons, it's just not a good thing.
Yeah, and not all the chairs aren't even ergonomically designed, and the way we sit at the desk isn't, And I'll tell them the focus distance of their computer. In our office, we'll talk about ergonomics. If you're going to be in front of a computer, how should you actually be doing it properly? How are you going to try and have a standing desk, or what all
They
the
do allow
options?
you the choice here.
Yeah,
So yeah,
which is
it really
amazing.
helps.
So
Yeah.
good job, Westland, for that.
Good job, Westland. Yes.
Yeah, a lot of offices, a lot of companies just don't, or they have to fight to get that. And I've written many letters like, they need a better chair, you need a better, standing desk, lots of different things. So we definitely see, the other one, which is kind of interesting, we see a lot of digestive problems. So yeah.
That's interesting.
It is, a lot of pressure on the spine can affect the stomach or slow down the intestines or speed them up. So I would say digestive problems, and we do nutritional stuff too. So believe it or not, probably they don't come in for it, but we're just seeing so many more people with anxiety and depression on top of their back pain and their headaches and their migraines and their shoulder pain and their sciatica, whatever it is. And then everything starts kind of grouping together. So we're trying to naturally help them, mitigate any of those effects, or maybe it's a deficiency that they can help with. So
it's interesting because everything is connected. The central nervous system, the bones, the cartilage, the tissue, everything works together. So, and I think more in chiropractic care than any of the other MDs. Okay, they understand that connection between nutrition, the body, how it works, how it connects to the other parts of the body. And like you said, like with sciatica and something, it may not, and how the nerves and this affects the brain. And so it's very interesting to me because that's more like an overall knowledge of how the body actually works.
You're spot on. See, again, in the philosophy between we're holistic versus mechanistic. The whole organism. If I step on your toe, I can raise your heart rate, your blood pressure. I can make you nauseous. If it hurts enough, we can affect your stomach, your digestion, just with enough nerve pain in one area, right? So we know that the toe affects everything. In the medical model, they know more and more about less and less, and that has its drawbacks, right? I said the average doctor takes care about this much, right? You have your heart guy, stomach guy, your gal, nose, throat, And I was teasing someone the other day. I said, one of my patients before they got here was trying to get a carpal tunnel because he had carpal tunnel surgery, and they said, well, you need carpal tunnel surgery. Yeah. Well, do you need a left-handed doctor or a right-handed doctor, right? It almost felt like it was getting that specific,
Right.
So it's just really, you can't keep slicing the body down and down and down, because every part can interact and affect other parts, and sometimes expected and sometimes unexpected ways.
Well, sciatica I'm glad you brought that up, because a lot of people that I've talked to through the years, that's a big problem. And so, but they really don't seem to know, they don't have any answers, not they, but the people who should be patients to begin with. Right. Is there something that chiropractic care can do to help alleviate that? Or is this a big puzzle?
No, I've definitely see people with sciatica, every single day in my practice. I would say every single day someone's dealing with it. And that's because we're so successful at getting rid of it. So more and more people are understanding sciatica means you've got inflamed nerves. And the sciatic nerve is actually one of the biggest nerves in your body, and it kind of starts in your lower back, your lower lumbar spine, and it can actually go all the way down the leg, and you can feel the effects all the way into your feet, sometimes into your toes. So just depending, but you feel mostly it's all down the butt and the back of the leg. And when we start to get pressure off the nerve, so you have to look for the cause. Mm-hmm. So in our office, we go, okay, I'm a chiropractor and wellness consultant, so I go, what's the root cause? And that means you have to look for things like toxicities and deficiencies. If you don't have any magnesium, you might start cramping all over the place, and now you can take stuff for cramping, but you really just need, say, an example, magnesium. We look for stress, which causes all kind of problems, and hormone imbalances. So if we can help right those things, and of course we're talking right now about joint damage and nerve irritation. So if we can start getting the joints to move, because some joints can irritate nerves, the irritated nerve spasms muscles, it pinches the piriformis muscle, which actually the sciatic nerve goes through muscles as it goes down your leg. So we get rid of nerve pressure. We have to sometimes work on the muscle, give exercises, stretches, and then kind of look at correcting the cause. Did you fall down, or what is this? Do you have a couch chair? I mean, these are fun for an interview, but I certainly wouldn't recommend sitting in this chair all day watching TV. And so do we need to change the chair, or do we need to change how you sleep? So you really have to look at the whole person, not just the condition. Sciatica is a condition, but what else is going on with that person that got him there? Do we need to strengthen some things? Do we need to stretch some things on top of that?
That's interesting that you say that, because like you said, a chair, and if you sit in a chair all day long at your job for 8 hours, it's like sometimes you just don't think, well, it's a chair, it's not the most comfortable chair, okay, but that's what I have. And sometimes those little changes can make a big difference.
Oh, absolutely, huge. The type of chair you're in. Even changing the monitor. So most of the time, a lot of times people are looking sort of down at their monitor and their neck is going forward. Well, if you raise your monitor, now you can be more upright all day long.
That's right. Yeah, we're seeing a lot of those things that technology, they're not such great. There are benefits to technology, but those things are definitely drawbacks. So you got to weigh some of those. Yeah, right? Unexpected consequences.
And that's what we don't find that always out till later.
Right.
Okay, well, because computers are going to make our life easier, and okay, never mind. But either way, all that technology, we actually, like you said, now we're sitting instead of moving. And actually, a lot of factory workers, OSHA's been paying attention to them, and they actually are having less. I actually see more desk people in my office than I do factory people as a whole.
Well, let's talk a little bit about inflammation, and what is inflammation?
Well, inflammation is a natural response to irritation in the body. Now, we probably all have seen inflammation in your gums, and your gums swell up. So inflammation can cause swelling, inflammation can cause pain. Now, you could also have inflammation of joints of the wrist, and now you have like carpal tunnel things. But inflammation is when the body is not able to finish a healing cycle, and it's in the kind of the beginning stages of that. So if you can imagine, if you ever smashed your finger, it swells up, gets puffy, right? And then it draws in white blood cells and different things to help it heal. But our problem is we have chronic inflammation, and oftentimes it's systemic. Mm-hmm. I mean, it can happen from traumas and accidents and injuries. It can also happen from dietary things. If you look at our diet, the American food pyramid was a disaster. It's completely false. It was just put together by all the big companies, the dairy industry and the beef industry, right? And that's why we go, wait a minute, if you added all those up, your servings of this, that, and the other, you would find out it doesn't get you 100% of what you need. That's why they go, okay, well, the Mediterranean diet, different diets are just so much better. Well, if you look at certain things can cause inflammation, wheat is one of them. Probably you've heard of that. One of the common causes of inflammation would be wheat. Wheat has actually changed so much over the last few years. When you were growing up, did you know anyone who couldn't eat a sandwich?
Yeah, no.
No. Now people can't even eat sandwiches. They can't have a loaf of bread or bread. It's so different the bodies are rejecting it, and that causes all kind of inflammatory things into the heart, throughout the entire body. Even the brain can get inflamed in there. Low levels, I'm not talking about. So inflammation is just simply the body's in an immune response. It's trying to heal, it's stopped, but there's swelling and pain and chemicals. Alarms, inflammation is alarms are going off, but nothing's actually happening.
Yeah, I think there are so many different things that we need to educate people about, and we have actually run out of our time. However, in September, we're going to do another set, and I'd like to have you back so we can talk about some of the things we didn't get to today. But I think
Absolutely love to.
Yeah, if people need to get in touch with you, how would they do that?
Well, the easiest way, we're in Canton. If you're familiar with Canton, we're between Warren and Joy Road, so we're actually pretty close to here. We face Canton High School, so it's Brackney Chiropractic Health Centers, and our number is really easy. It's 734, which you would imagine, 455-4444. So 734-455-4444. But you could text us, brackneychiropractic.com. I mean, there's a lot of, you can text that number, you can call that number. We've been around for a long time, so we're pretty easy to be found if you look. But
Well,
again,
a lot of seniors have problems with knees, and that's one thing we're going to be talking about when you come back, because there's some new things that they're doing, but we'll keep everybody in suspense.
I like it, Brian. You've done
Yes.
this before.
Well, thank you so much,
Absolutely.
Dr. Brackney,
I really
for being
appreciate you
here.
having me. I really hope some of the information I had was helpful. That is ultimately our goal. We're here to educate, adjust, inspire people to maximum health. Our ultimate goal is get people we call to the C Club, which is a Century Club, happy and healthy to 100, and that's what we're working toward.
Wonderful. Well, thank you again.
Thank you.
And thank you, those of you who have joined us today. I'm Barbara Marcum, and this is Friendship Focus.